Hi med scholars, welcome to today's video on Anatomy MCQs. It is part of the Med Scholars Anatomy MCQ series aimed at preparing students, both medical, nursing and paramedics, for various science and medical exams. Do well to subscribe to this channel if you have not done so, and stay tuned for more videos. So let us begin with today's MCQs. Test your knowledge and prepare for exams with standard multiple choice questions. We are beginning with question 31. Caudal tympani nerve contains A. General visceral efferent fibers, B. Preganglionic parasympathetic fibers, C. Special visceral afferent fibers, D. All of the above are correct, E. A and B are correct. The caudal tympani nerve is a branch of the facial nerve that carries taste sensation from the anterior to third of the tongue, and it contains all of the above fibers. So the correct answer to this question is option D. All of the above are correct. Okay, option D. All of the above are correct. Question 32. Tensor tympani muscle is innervated by, we are being tested on the innervation of the tensor tympani muscle. A. Cochlear nerve, B. Facial nerve, C. Vestibulocochlear nerve, D. Caudal tympani, E. Mandibular nerve. And the answer to this question is the mandibular nerve, option E. Option E, mandibular nerve is the answer. Question 33. What forms the floor of the tympanic cavity? Yeah, the tympanic cavity has got a floor, an anterior wall, posterior wall, superior and inferior. The inferior is the floor. So option A, jugular fossa. Option B, tegmen. Option C, auditory tube. Option D, external auditory meatus. And the answer to this question is the jugular fossa. The jugular fossa forms the floor of the tympanic cavity. Yeah. Question 34. What is the smallest striated muscle in the human body? Striated, S for S. The answer to this question is the stapedius. So it is the smallest striated muscle in the human body, but its function cannot be underestimated. Other options include tensor tympani, masseter orbicularis oculi. They are all wrong. The answer is option D, the stapedius. Question 35. Which of these structures does not belong to the tympanic cavity? A. Head of malleus, B. Lesser petrosa nerve, C. Oval window, D. Round window, E. Vestibule. The two windows belong to the tympanic cavity. The head of malleus is found right there. The vestibule is found right there. The only odd option is the lesser petrosa nerve. The lesser petrosa nerve carries parasympathetic fibers to the otic ganglion. That is the answer to this question. Option B, lesser petrosa nerve. Question 36. If you have to relieve pressure in the tympanic cavity due to inflammation, where in the tympanic membrane would you insert needle to avoid damaging internal structures? So what is the site or approach we use for a typical myringotomy? Option A, first quadrant. Option B, second quadrant. Option C, third quadrant. Option D, fourth quadrant. Option E, none of the above. So and the answer to this question is the fourth quadrant. So the fourth quadrant is the best approach. Other quadrants are related to structures, okay? Question 37. Which nerve innervates internal surface of the tympanic membrane? Which nerve innervates the internal surface of the tympanic membrane? Option A, glossopharyngeal nerve and facial nerve. Option B, glossopharyngeal nerve. Option C, trigeminal nerve. Option D, trigeminal nerve and facial nerve. Option E, vagus nerve. The answer to this question is option B, the glossopharyngeal nerve. Okay? That is the answer to the question. Question 38. What part of the external acoustic meatus consists of cartilage? A. Inner 1/3. B. Outer 1/3. C. Inner 2/3. D. Outer half. E. None of the above. Okay, so the cartilaginous part of the external acoustic meatus is the outer 1/3. Option B is the answer. Question 39. Which of the following muscles is not innervated by cranial nerve 3? Cranial nerve 3 is the oculomotor nerve. A. Lateral rectus muscle. B. Medial rectus muscle. C. Superior oblique muscle. D. A, B, and C are correct. Option E says A and C are correct. And the answer to this question is option E. A and C are correct. The lateral rectus muscle and the superior oblique muscle are not innervated by the oculomotor nerve. The lateral rectus is innervated by the abducens, and the superior oblique is innervated by the trochlea. Question 40. Which of these structures attach at the short process of the Mcqs? A. Stapes. B. Annular ligament. C. Tensor tympani muscle. D. Posterior ligament. E. None of the above. The answer to this question is the stapes. Option A. Question 41. Which of the following nerves is located in proximity of the clevis? You know what is the clevis? That bone in which the brainstem lies over. That's what is called the clevis, in the base of the skull. A. Optic nerve. B. Oculomotor nerve. C. Ophthalmic nerve. D. Trochlear nerve. E. Abducens nerve. And the answer is the abducens. A, B, do sense. The abducens is the answer to this question. The innervator of the lateral rectus. And the answer is the abducens nerve. Alright. Question 42. The afferent limb of the corneal blink reflex is made out of fibers from which nerve? A. Trigeminal nerve. B. Oculomotor nerve. C. Trochlear nerve. D. Abducens nerve. E. Facial nerve. And get what's the answer to this question? Is the trigeminal nerve. So the trigeminal nerve gives the afferent limb of the corneal blink reflex. That is the answer to the question. Question 43. What nerve is a source of sensory innervation for lacrimal gland? Oh, do you want to have some tears? What nerve is responsible? Is the facial nerve. And the answer to this question is option C, the facial nerve, the cranial nerve 7. Question 44. Which of the following does not innervate the auricle? The auricle is the outer ear. Option A, vagus. Option B, lesser occipital nerve. Option C, facial nerve. Option D, trigeminal. Option E, vestibulocochlear. And the longest name here is the vestibulocochlear. And that is the answer to this question. The vestibulocochlear does not innervate the auricle. Okay. Question 45. From which structure does the facial nerve emerge from? A. Foramen ovale. Now the foramen ovale is found down there in the heart. B. Superior orbital fissure, not at all. B. Zygomaticofacial fissure, no. C. Stylomastoid foramen, and that is the answer to this question. Option C, the stylomastoid foramen. Question 46. Where are the cell bodies of primary sensory neurons of the facial nerve located? Where are the cell bodies of the primary sensory neurons of the facial nerve located? A. Pterygopalatine ganglion. That sounds awkward. B. Superior cervical ganglion. That sounds too far. C. Optic ganglion. That sounds too short. D. Geniculate ganglion. And that sounds appropriate. So the answer to this question is the geniculate ganglion. The geniculate ganglion for the cell bodies of the primary sensory neurons of the facial nerve. That is high yield. Question 47. What is the inner layer of the eyeball called? Cheap question is the retina. So the answer to this question is the retina. Question 48. Which of the following contain the fovea centralis? You know what is the fovea centralis? And where is it found? Option A, optic disc. Option B, macula. Option C, cornea. Option D, iris. Option E, lens. The answer to this question is the macula. It's the macula. So remember, the fovea centralis is in the macula. Question 49. What structure passes through the incisive canal? Passes through the incisive canal. And when you say incisive canal, it is related to the incisor. Okay? A, nasopalatine nerve. B, descending palatine artery. B, artery that forms communication with greater palatine artery. C, A and B are correct. D, all are correct. And the answer to this question is the nasopalatine nerve. The incisive canal is so small that it can only transmit the nasopalatine nerve. Okay. Question 50. Olfactory nerve has what type of fibers? A, special visceral efferent fibers. B, special visceral afferent fibers. C, general visceral afferent fibers. D, general visceral efferent fibers. Of course, smell, the sense of smell is one of the special senses. So it's a special sense. So it's going to be a special viscera. Okay? And because it's sensory, it's definitely option B, special visceral afferent fibers. Good. Oh, question 1. Let's go. During a surgical procedure involving the thyroid gland, the recurrent laryngeal nerve is at risk of injury. While ligating, which of the following structures does the recurrent laryngeal nerve get injured during thyroid surgery? And the answer to this question is the inferior thyroid artery. So it has a close relationship with the inferior thyroid artery and is very much susceptible to injury at this point. And the answer to the question is option C. Remember that injury to the recurrent laryngeal nerve can give dysphonia, okay, or other changes in the voice, particularly hoarseness, okay, of the voice. All right. Question 2. During a dental procedure, a dentist inadvertently damages the lingual nerve. That was a very poor dentist. While administering local anesthesia, which of the following sensations is most likely to be affected? A, pain sensation from the anterior two-thirds of the tongue. B, temperature sensation from the posterior one-third of the tongue. C, proprioception from the posterior one-third of the tongue. D, taste from the anterior two-thirds of the tongue. The lingual nerve doesn't carry taste. Option D is out. The lingual nerve doesn't supply the posterior two-thirds. So the answer to this question is pain sensation from the anterior two-thirds of the tongue. And that is the correct answer. So the lingual nerve is a branch of the mandibular nerve and primarily carries general sensory fibers such as touch, pain, and temperature from the anterior two-thirds of the tongue. It does not carry taste sensation. That is the function of the caudal tympanic branch of the facial nerve. Alright. Question 3. A 10-month-old boy accidentally swallowed a small magnet of his toy car. He began to suffocate and was rushed to the hospital, where an X-ray examination showed impaction of a foreign body in the larynx. Which of the following statements is not true? So there's an impaction of a foreign body in the voice box. A, rima glottis is the narrowest part of the larynx. B, lateral cricoarytenoid is the safest muscle of the larynx. C, vocal cords are purely white in color. And that is the answer to the question. So vocal cords are purely white in color is false. This statement is not true. The vocal cords or vocal folds are typically pinkish or slightly reddish to the underlying vascular tissue. Okay? And option D that says each vocal fold contains vocal ligament and vocalis muscle is absolutely correct. Question 4. Which of the following statements is not true about the styloid process? You know the styloid process? The bony projection that lies anteromedial to the mastoid process. A, styloglossus arises from the anterior surface of the tip. B, lateral it is related to the parotid gland. C, medially related to internal carotid artery. D, stylopharyngeus arises from the posterior surface. No, not at all. The stylopharyngeus muscle does not arise from the posterior surface. Rather, it arises from the medial surface of the styloid process. Okay? So the correct answer to this question is the stylopharyngeus arises from the posterior surface, because that is false. Question 5. A 25-year-old male presents to the emergency department with a complaint of recurrent epistaxis over a few weeks. He reports that the bleeding usually starts spontaneously and is difficult to control. On examination, you note dried blood in the nasal passages, and on further evaluation, you identify the source of bleeding to be in the anterior part of the nasal septum. The bleeding stops temporarily with local pressure, but recurs when pressure is released. Which of the following vascular structure is most likely responsible for the recurrent epistaxis in the patient? Remember that where it's affected is the anterior part of the nasal septum. Okay, so the sphenopalatine artery is out, the greater palatine artery is out, the posterior ethmoidal artery is out, and the answer to this question is the anterior ethmoidal artery. So the anterior ethmoidal artery is responsible for this epistaxis. Remember that there's an anastomosis of arteries, okay, within this area, and that area is known as the Little's area, and that plexus of arteries is known as the Kersebach's plexus. So the anterior ethmoidal artery is a branch of the ophthalmic artery and supplies the anterior part of the nasal septum and the superior nasal cavity. This artery is a key contributor to Kersebach's plexus, a highly vascular region in the anterior septum that is a common size of epistaxis. The patient's description of recurrent spontaneous bleeding from the anterior septum strongly suggests involvement of the anterior ethmoidal artery. Oh, did you know there's a blood red waterfall in Antarctica known as blood falls? This airy crimson flow comes from a glacier in the Mcqs dry valleys. The color is due to iron-rich salt water that has been trapped underground for millions of years and oxidized as it flows out. That is amazing. So this is the Antarctica's blood red waterfall. Question 6. An elderly patient presents with difficulty in opening his mouth due to trismus. Examination reveals a firm mass in the infratemporal fossa. Firm mass in the infratemporal fossa. Which of the following muscles is most likely to be involved in this condition? And if you're thinking of the lateral pterygoid, chocolates for you. Some chocolates for you, okay? And the answer to the question is option D, the lateral pterygoid. The lateral pterygoid is the most likely muscle involved in this condition due to its location in the infratemporal fossa and its function in mouth opening. The firm mass in the infratemporal fossa combined with patient's trismus points to an issue with this muscle. Absolutely. Question 7. A 45-year-old male presents with weakness of the muscles of mastication. No, that's not a good one in the Middle Ages. Examination reveals deviation of the jaw to the left. A muscle must be paralyzed there. When he opens his mouth, which of the following nerves is most likely affected? A. Mandibular nerve. B. Facial nerve. C. Hypoglossal nerve. D. Trigeminal nerve. And the answer to this question is the mandibular nerve. The muscles of mastication is affected. The mandibular nerve is responsible for the motor innervation of the muscles of mastication, including the masseter, the temporalis, and the pterygoid muscles. If there's damage to the mandibular nerve, it can cause weakness in these muscles, which leads to deviation of the jaw to the affected side during mouth opening, as seen in this 45-year-old male. That is what is happening. Question 8. What is the action of superior head of lateral pterygoid muscle on the mandible? A. Elevation. B. Depression. C. Protraction. D. Both A and B are correct. E. Both B and C are correct. And the lateral pterygoid muscle is very much responsible for depression and protraction. So the answer is option E. It depresses the mandible and it protrudes the mandible. Okay. It can also assist in lateral movement of the mandible, contributing to chewing and grinding motions. That side-to-side movement you see in goats, very much important. The lateral pterygoid. All right. Question 9. How many bones does the viscerocranium consist of? The viscerocranium. How about we try to spell this word viscerocranium? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. It contains 14 bones. And that is the answer to this question. So the answer is option A, 14 bones, okay? But don't do that in board exams, please. So the viscerocranium consists of 14 bones. These 14 bones are A, nasal bones, maxillae, zygomatic bones, palatine bones, lacrimal bones, the crying bones, inferior nasal concha, vomer, and the mandible. So the correct answer is option A, 14 bones. Question 10. What kind of joint is the temporomandibular joint? Very much important. Very much important. So the temporomandibular joint is a synovial joint of the hinge variety. Option B is the answer. It possesses articular surfaces that are separated by a fibrous intra-articular disc. The answer is option B, synovial joint of hinge variety. Okay, did you know there's a lake that never freezes? Lake Vostok, located beneath Antarctica's ice sheet. Remaining liquid despite being in one of the coldest regions on Earth. The lake is buried about 2.5 miles or 4 kilometers below the ice, and it stays liquid due to geothermal heat from the Earth's core and the pressure of the overlying ice. Yes, it's amazing because the Antarctica is definitely an extremely cold region made up of ice and glacier. However, this lake does not freeze. Lake Vostok. And here's Lake Vostok, the lake in the Antarctica that never freezes. Question 11. The skin of the chin is innervated by, it's a typical board question. It's testing you on the nerve supply to the face. A, supratrochlear nerve. B, mental nerve. C, zygomaticofacial nerve. D, buccal nerve. E, lingual nerve. And if you blow the trumpet, you're using your buccinator. Definitely for the trumpeters. So the buccal nerve is the answer to this question. Okay? So the buccal nerve. Option D is the correct answer. Question 12. Mastication muscle comes from branchial arc. You can replace branchial arc with pharyngeal arc. That sounds better. Option A, cranial nerve 4 and 5. Option B, cranial nerve 2. Option C, cranial nerve 2 and 3. Option D, cranial nerve 1 and 2. Option E, cranial nerve 1. The answer to this question is option E, the first branchial arc. So the first branchial arc, okay, gives rise to the muscles of mastication. So the answer is the first branchial arch, not the fourth and fifth, not the second, not the first and third, not the first and second, but just the first branchial arch. So it forms the muscles of mastication, including the masseter, the temporalis, the pterygoid, and all the muscles of mastication. Question 13. The facial nerve innervates the orbicularis oculi by A, supraorbital nerve, B, supratrochlear branch, C, upper buccal nerve, D, zygomatic branch. And the answer to this question is the zygomatic branch. So the orbicularis oculi muscle is innervated by the temporal and zygomatic branches of the facial nerve. Question 14. Which of these muscles is not innervated by motor fibers of the trigeminal nerve? A, masseter, B, temporalis, C, buccinator, D, lateral pterygoid, E, medial pterygoid. So which of these muscles is not innervated by motor fibers of the trigeminal nerve? And the answer to this question is the buccinator. So the buccinator is innervated by the facial nerve and not by the trigeminal nerve. Question 15. Which nerve is responsible for afferent limb of the corneal blink reflex? A. Facial nerve. B. Nasociliary nerve of the ophthalmic division of the trigeminal nerve. And that is the answer to this question. The nasociliary nerve, okay, is responsible for providing the afferent limb of the corneal blink reflex. So did you know there's a place on earth where you can stand in 4 countries at once? That sounds interesting. The point where the borders of the United States, Canada, Mexico, and the Caribbean intersect is known as the Four Corners region of the world. This is only point in North America where 4 states or countries meet. And that is the Four Corner point in the United States of America. Question 16. The optic ganglion provides nerve fibers to innervate dash. A. Submandibular gland. B. Sublingual gland. C. Parotid gland. D. Lacrimal gland. E. Thyroid gland. And the answer to this question is E. The thyroid gland. Is C. The parotid gland. So the parotid gland receives fibers from the optic ganglion. Okay? So the parasympathetic fibers from the optic ganglion innervates the parotid gland. And these fibers travel through the auriculotemporal nerve to reach the parotid gland, where they stimulate saliva secretion. So they are secretomotor fibers. Question 17. Cauda tympani enters what nerve in the inferior temporal fossa? A. Deep petrosal nerve. B. Lesser petrosal nerve. C. Lingual nerve, a branch of mandibular nerve. D. Lingual nerve, a branch of maxillary nerve. Definitely it's through the lingual nerve. And the lingual nerve, a branch of the mandibular nerve. So through the into the infratemporal fossa. Option C is the answer. The cauda tympani joins the lingual nerve, which is a branch of the mandibular nerve in the infratemporal fossa. Question 18. Which of the following is not a terminal branch of cranial nerve 7? A. Temporal branch. B. Sphenoid branch. C. Zygomatic branch. D. Buccal branch. E. Cervical branch. Not for the sphenoid. Option B is the answer. There is no sphenoid branch. Question 19. What cranial nerves are passing through the superior orbital fissure? Yes, if you think of cranial nerve 3, it passes through. Cranial nerve 4, the trochlea passes through. Okay? Cranial nerve 6, the abducens passes through. And the ophthalmic branch of the trigeminal nerve. So the answer to this question is option B, and that gives it off. Question 20. Frey's syndrome is caused by injury to dash. Frey's syndrome is caused by injury to which nerve? And the answer is the auriculotemporal nerve. Option B is the answer to this question. So did you know the Eiffel Tower, where is it found? It's found in Camp de Mars in France. So the Eiffel Tower in France can grow taller in the summer due to the expansion of iron when it heats up. The Eiffel Tower can increase in height by up to 6 inches, about 15 centimeters, during warm weather. In winter, it contracts back to its normal size. That is a very beautiful dynamism. Okay, and why you should think about the expansivity. Remember in physics, when you were discussing the linear expansivity, cubic expansivity, and all of that, that's what is happening here. So the Eiffel Tower in Camp de Mars, Paris. Question 21. The Stensen's duct pierces which of the following structures on its way to the oral cavity? A. Masseter. B. Depresso angularis oris. C. Sublingual gland. D. Buccinator muscle. E, A, and D are correct. And the answer to this question is the buccinator muscle. So it pierces the buccinator muscle on its way to the oral cavity. Okay. Question 22. What structure lies deepest in the parotid gland? Oh, it's the facial nerve. It's the facial nerve, and the answer is option D. It's the facial nerve. Question 23. Which of the following is not a derivative of the second pharyngeal arc? A. Stylohyoid muscle. B. Posterior belly of digastric. C. Stapedius muscle. D. Temporalis. And the answer to this question is the temporalis, option D. This muscle is a derivative of the first pharyngeal arch, not the second pharyngeal arch. Question 24. Muscles of facial expression develops from A. Ectoderm in the first pharyngeal arch, no. B. Mesoderm in the first pharyngeal arch, no. C. Endoderm in the second pharyngeal arch, no. D. Mesoderm in the second pharyngeal arch. Correct. Absolutely. So they are derived from the mesoderm of the second pharyngeal arch. And they are innervated by the nerve of the second pharyngeal arch, and that is the facial nerve. What a dedication. What a specificity. Question 25. What kind of fibers makes majority of the greater petrosal nerve? You see that it's a great nerve, so it has multiple types of fibers. But what forms the majority? A. Afferent fibers. B. Efferent fibers. C. Parasympathetic fibers. D. Sympathetic fibers. E, A, and B are correct. The answer to this question is parasympathetic fibers. Option C. So the parasympathetic fibers form majority of the greater petrosal nerve. Did you know the walking palm, known as the Socratia exoriza, is a palm tree native to Central and South America that's known for its unique roots that give it the appearance of moving. The tree's roots extend from the trunk into the ground at an angle, providing stability and support. The tree is said to move by growing new roots on one side and letting old ones die, which can cause it to move up to 2 to 3 centimeters per day. And that is the walking palm, the Socratia exoriza. Okay, the walking palm. Question 26. What is the common tendon for attachment of frontal and occipital bellies of occipitofrontalis? You know that muscle name you don't want to see in board exams. The occipitofrontalis. A. Occipitofrontalis tendon. B. Cranial tendon. C. Supracranial aponeurosis. No. D. Superior sagittal aponeurosis. No. Option E. Epicranial aponeurosis. Correct. The epicranial aponeurosis is that common tendon for the frontalis and the occipitalis, or the frontal and occipital head of the occipitofrontalis muscle. Correct. Question 27. The main action of levator levi palati muscle. It's an elevator of the palate. A. Elevates labia commissure. False. B. Depresses labia commissure. Wrong. C. Elevates labia commissure and protrudes upper lip. False. D. Widens oral fissure and protrudes upper lip. Wrong. Option E, none of the above. And the answer to this question is option E, none of the above. Okay. Question 28. What part of orbicularis oculi muscle keeps cornea from getting dry? What part of orbicularis oculi muscle keeps the cornea from getting dry? A. Lacrimal part. B. Muscular part. C. Palpebral part. D. Orbital part. E, A, and B are correct. The answer to this question is the palpebral part. Okay, it keeps the cornea from getting dry. Very faithful part. The palpebral part of the orbicularis oculi. All right. Question 29. Carotid canal is the tympanic cavity's dash. A. Roof. B. Floor. C. Anterior wall. D. Posterior wall. So the carotid canal forms the anterior wall of the tympanic cavity. And option C is absolutely correct. Option C is the answer to the question. Question 30. Most of the superficial arteries of the face are branches of A. Internal carotid artery, B. External carotid artery, C. Maxillary artery, D. Facial artery. And the answer to this question is the external carotid artery. It gives rise to pretty numerous branches that are very much important for supplying the face, and they are superficial. So the answer is option B, the external carotid artery. Did you know the slowest animal in the world is the three-toed sloth, belonging to the bradypus family? Sloths are famously sluggish, moving at an average speed of just 0.03 miles per hour. That's slower than a human walking pace. Their low metabolism and energy-efficient lifestyle are key reasons for their slow movement. Sloths spend most of their lives hanging upside down from trees in the tropical rainforests of Central and South America, and their slow pace helps them conserve energy and avoid predators. A sort of mimicry. They walk damn so slow. They remain static, so you think they are leaves in a tree or whatsoever, or rather scarecrows, and they survive predators. Alright. And here is the three-toed sloth. Okay? And with a baby sloth right there. Thanks for watching. Like and subscribe and share. Stay tuned for more video from Med Scholars. Thank you very much. Until next time.